Thank you so much, Kelsey. It's a real pleasure to be with everyone today. We feel like we're with our people when we're we're presenting to the Federation. And we did present last year. We presented about our Lifting Voices initiative, and we were delighted to be featured as the action for the Federation in the May Mental Health Awareness Month. And are really just thrilled to be with you today to share kind of what we've been up to in the past year and what we've learned from the surveys over the past, I guess the last year and change was sort of a cumulative sharing of our findings. I'm Heidi Arthur. I am both a mother of a child with serious mental health issues and condition, and I'm also a behavioral health consultant. So I've worked with all sort of aspects of the system of care for nearly 30 years now. And so this work, this initiative that is independent and it's separate from my work as both a consultant and it's really a labor, I guess it's a passion project because what I learned as my child began to struggle was that none of the professional experiences or connections or knowledge that I had of the system was preparing me to really navigate and to find what my child needed in a timely manner. And so this initiative has really kind of grown out of a desire to advance equity, promote quality, and really address stigma in the mental health and substance use disorder systems, and really kind of bridging what I do professionally in terms of advancing mental health awareness and access, and also personally what I feel passionate about in terms of supporting other families. So my lens is that of a sort of a bridge to the professional clinical arena, and as a peer, a person who's really kind of walked this path with a child with suicidal ideation, risk, and complex condition. Ellen, let you introduce yourself, and then we'll dive in and we'll tell you what we've learned and a little bit more about the initiative.
Great. Thank you very much. And so just to kind of piggyback on what Heidi's saying, let me just tell you a little bit about myself as a mother and as a professional. And I too am trying to bridge those two pieces together to improve the system and end stigma. And I'm a mother of a son who is now 23 years old. He has miraculously survived 2 fentanyl overdoses. He has substance use disorder, and he certainly has availed himself of traditional and non-traditional treatments and interventions over the last 10 years. It's a journey. And as a professional, what I do and what I've been doing basically for over 35 years is I'm a health policy expert and I do a lot of research, writing articles. This is a passion project for me too. So thank you all for being here, and back to you, Heidi.
Thank you so much. So basically, Ellen and I were coping with our children's serious behavioral health conditions at around the same time. We also both lost our mothers at the same time. We're colleagues at Health Management Associates, which is a national consulting firm that specializes in publicly financed healthcare and promotion. And we connected as colleagues and really kind of felt like, oh, wow, it's so great to find you because you're dealing with some of the same things that I'm dealing with. And isn't it so surprising that we're really kind of flailing despite really having an understanding of how the system works and what is necessary in order to access care? And so we actually started Lifting Voices because we realized that, our kids were having access to resources. We were sort of stumbling our way forward, but our kids were getting access to resources that we knew were not available to every kid. And our kids were experiencing a level of care that we knew was not readily accessible to all youth and kids across the country. And we felt like as consultants and as parents, we could really help to advance some of the models and things that we had found effective. But we really also felt like there wasn't a forum for people to talk about what their experience was, and there really wasn't a methodology to share the experiences of both young people about their experience of the system of care and families. And so Lifting Voices for Meaningful, Actionable Change was essentially a weekend and evenings project wherein Ellen and I started to reach out to our networks of peers who are sort of professionals and also family members whose kids were similarly confronting complex mental health and SUD types of conditions. And we essentially started with a very basic survey just to kind of hear their stories, and we started to compile that information. We spoke with folks. We did a focus group with young adults and a focus group with families, very much our own networks. And we started to identify some real themes and essentially realized that those themes were tracking across the experience of an even broader set of folks. When we created a survey, we used our HMA Qualtrics system to refine the survey. We got a little bit of protected time from HMA. We're able to sort of get some additional data, and in this past year, we were able to scale it and make it a little bit more official. And so essentially what it is it's two surveys. One is for young people, one is for families, and it's, really trying to gain actionable intelligence from people with lived experience in order to share that back to the system leaders and policymakers and providers in order to advance the movement to improve the mental health and delivery system. So really kind of started in 2023 with, just like I said, some initial surveys, focus groups. We presented what we learned at the Camden Coalition, and we worked on a bunch of conference proposals that took us into 2024, where we really essentially I think we were kind of reality testing. Is there a there in terms of getting this kind of information? And we were validated at every turn. We presented at the National Council for Mental Well-Being, the National Federation for Families last year. And then this spring, we were able to participate in some of the last SAMHSA workshops around family support and recovery support. And we were really delighted that the Federation was able to give us tremendous lift. And many of you responded to the surveys during the Mental Health Awareness Week. And now we're with you, and we're poised to take the project forward. Our goal is to really expand our reach and really deepen our engagement and fill some of the gaps in participation. But what we wanted to share with you today is some of what we've learned so far. We've had about 300 respondents, parents as well as young people. And what we've heard, here you can see some of the quotes. My child tells horror stories, not so much about their own experience, but about what they've observed happening to other children, particularly children who don't have involved and educated parents as advocates. From youth, young adults, I entered the mental health care system with some challenges, but didn't develop PTSD until after I'd been in the system. Every layer of this initiative, I think, has been more reinforcing about the value of hearing the experience of families and young people. And as consultants, I feel like Ellen and I and our counterparts, I'll talk a little bit more about some of the co-founders, we're really trying to get as much information as possible. So we collect data both quantitatively and qualitatively, but also trying to really distill, what are we hearing that's kind of consistent, and where are these, sort of like really valuable quotes. I mean, here you can see families expand covered services. From youth, it's a broken system. I felt complete dehumanization. So really there's been, both what's not working as well as, some of what people have actually found to be helpful. And then Ellen will walk through what we've, how we structured it and what we've learned. So our goal here is really to combat stigma, other forms of discrimination, and kind of level the playing field so that everyone has fair access for children, youth, and for young adults. And our core group of youth and families with lived experience who helped design the survey and kind of craft the initiative includes some really fabulous folks. So in addition to myself and Ellen, who you've met, we also had have ongoing participations. Sheila Gouch is a parent of two children, both of whom have pandas. And she's a principal at Dearborn Academy, which is a therapeutic high school. Kelsey, who you know and love from the Federation, brings her lived experience and her experience with the Federation and her marketing genius. She is the master of design who helped craft our beautiful website. And Echo Lustig is a young person with lived experience. Echo shared their dissertation from college, and it's part of an early report we developed. And we scooped Echo up to be an ongoing advisor. And additional young people and family advisors who are part of that original core group have really helped to shape sort of a collective response. And so going forward, our vision is to establish a partnership with a not-for-profit in order to help us, garner philanthropic funding so that this really can stand on its 2 feet and get the dissemination lift that it warrants. And we want to expand survey engagement. We want more youth and families, particularly more young people who have substance use disorder and more diverse populations to be represented. And in doing that, we want to establish a diverse advisory board and we want to put more attention into how we do our participatory approach to the research. So right now it's been a lot of, our time and energy sort of using our consulting skills, but we really want it to be more engaging of those who do have lived experience and a sort of helping to shape what is it we're looking at in this data and how do we take it forward. And we want to continue to refine the survey. We've learned that our lens going broad meant that necessarily we need a brief option of the survey. We need to, kind of mix it up a little bit. And we want to build some dashboards that help to track our progress in actually making a difference. And we want to do that at the state level. So we want to go big and we want to make it really actionable. This is just a quick one-page, overview of what is Lifting Voices. So our founders are parents who are professionals and young people with lived experience. We started with a very small convenience sample, some focus group surveys, and we're really launching a much more formalized survey. And our vision is to address stigma and in some of the pain that young people and families experience when coming up against some of the barriers to mental health access and substance abuse access to care. We want to establish a real partnership with some of the existing national organizations that are advancing the movement and promoting equity. And our survey is really trying to get the personal accounts that people are experiencing as they receive mental health services, substance use treatment services, in order to help inform continued progress. And our goal with the findings is to really develop a dissemination plan that includes recommendations at the state and national level to improve practice that's really kind of backed up by the lived experiences of those who have the most knowledge and awareness, the people who are experiencing the system themselves. Here's a link to our website, and I think Kelsey's probably dropped it into the chat as well. I'm going to turn it over to Ellen to tell you what we've learned.
Wow, thank you very much, Heidi. That's an amazing overview of what we've been doing the last couple of years and really talking about our evolution in our future vision. And so we are at such a wonderful inflection point where we actually have some findings and recommendations with some real people's lives behind it and numbers of people. So the data that you're going to see, it's not just a statement. It means that there are more than 300 responses answering these questions, but about 83 parents and adults that we're going to focus on today. So thank you. And we're going to turn them into the next slide and we will dig into this survey report. So let me start with as Heidi shared, we developed a survey for parents and caregivers, and we developed a survey for youth and young adults. The questions were pretty similar, and I'm really simplifying them at a high level right now, but there are 5 key questions that we asked in our survey. And first is, what is your personal experience in accessing care within the child and youth service system? The second one is, how did unmet needs impact you? And I mean globally, your family, your income, in all other ways, and siblings, etc., your marriage. The third one is, where did you get your care? Where did you receive care? What were your needs met? What barriers did you face? I'm sure that the audience right now could list off a million barriers to the system in receiving the care they needed. And our job in doing this survey is to provide an evidence base. And the fourth question is, what recommendations do you have for all the people in the ecosystem of your youth's life? Pediatricians, programs, schools, mental health organizations. And then the fifth question is, can you tell us which interventions were most helpful to you? Which ones were least helpful? And as we walk through the results today, and then we'll get to some of the qualitative findings as well, I'm going to focus on question one, your personal experience. Question two, your unmet need. And then Heidi's going to focus on the recommendations. We're still digesting some of the data that has to do with receiving care because there are so many nuances there, and we want to interpret those findings thoroughly and accurately and thoughtfully. And then fifth is what interventions were most helpful to you. We're also digesting those. So haste does make waste, but we were really focused on 1, 2, and 4 in today's session. So let's dig in and go to the next slide here, which is really our focus on, we received 300 responses, and we are calling this the July 2025 Survey Response Report. And perhaps in 6 months from now, perhaps in a year from now, we'll have an even more robust sample. We might have a shorter survey as well. But what's most telling about this, and what's most telling about the survey results, is that in the 2 years since we did our convenience sample, our results are very similar to the convenience sample of 20 people. And that when we increase the numbers, the story about access and unmet needs and interventions and recommendations really didn't change in a dramatic way, but what we did is develop a bigger and more robust and more refined and more at the intersectional level that we can draw upon. So I just want to kind of put a pin in that because it's very telling that people are having very similar experiences in the system, regardless of where you are. And so let's go to the next slide. And in terms of survey dissemination, that's really important because we got 300, and that was a lot of work to get that 300. We did 2 separate surveys. We had the Lifting Voices website, and that's in English. And we also created 2 separate surveys. We collected the responses on a rolling basis, so we didn't require someone, please, you have 30 days to do it. We kept it open on a rolling basis for several months. We also shared the survey with state and national organizations like the PPALs, like the Federation organizations. And we also targeted the support in Massachusetts and New York. I live in Massachusetts, Heidi lives in New York, so we really leveraged our networks. And I think that if there is a major takeaway here, leveraging your networks, working with the community, we all know is most effective to go from this kind of high-level national outreach to really community outreach. And the behavioral health providers we worked with were extremely helpful in getting the response out. So if we move from the survey dissemination, let's dig into some of the survey results. And as I said, the first question was, tell us about your personal experience in accessing care. So this may not be surprising, but it is surprising that only 1 out of 2 parents says that they are able to receive appropriate mental health care that's available and accessible. So my heart immediately breaks to think, what about the 1 out of 2 who doesn't receive appropriate care? And then we know for the 1 out of 2 that does, it is a battle getting access to that care. 19% of parents with report that substance use care is available and accessible. That's 1 out of 5 families are able to access that substance use care. And as my son always says, Mom, all of the substance use care is mental health care for him. It's a combination of both. But those two results, the 1 out of 2 parents report that appropriate mental health care is available and accessible. 1 out of 5 parents report that substance use is available and accessible. They are statistics that you can hang your hat on. That's what our parents and caregivers told us. 42% of parents indicate that the system has harmed their child. And if we're all in this together here. So we know the various ways that children are harmed and sadly harmed in accessing care. So I want to move on, not because I don't want to talk about these results, but under the recommendations, I think that Heidi will share a little bit more. I didn't want to overwhelm you with numbers today either, just to give you sort of the high level facts. 70% of parents say that the child has often experienced unmet needs. That means many more people have experienced unmet needs than receive, have their needs met. 45% of parents say that the child's life has been threatened by unmet needs. 76% of parents say children's education has been negatively impacted by unmet needs. 51% say their marriage has been negatively impacted, and 79% say their mental health has been negatively impacted. Those statistics are staggering and really tell an incredibly powerful, if not completely sad, situation in our country that makes it a moral imperative for Heidi and I to keep on going with this work, because we have to continue to put the numbers and the stories in front of, whether it be legislators, whether it be state leaders designing mental health systems. But what we've got going right now, we know we need to improve upon. So I want to go to the next slide, which really now goes into the qualitative data findings. And back to you, Heidi.
Thank you, Ellen. I just want to remind folks that we are just focusing on the family data in this presentation, because the other piece that we haven't dug into is the youth findings at this point. And again, we are unfunded and have just been able to begin digesting the data. So a lot of our data came in May from the wonderful support of the Federation and its affiliates. So we haven't had either the bandwidth or funding to kind of do a very thorough, and we do want it to be participatory. So that is a work in progress. But what we do have for you are some of the key recommendations, some of the takeaways. Our process for this was not as scientific. It was really kind of like eyeballing a lot of data in a spreadsheet, but really just a drumbeat across all of these groups: pediatricians, schools, youth serving organizations like your YMCAs or your Boys and Girls Clubs. Those kinds of agencies and communities, and mental health and substance use organizations. Was listen to families, talk with families, be open to hearing what people say. You can see, be patient, accommodate our kids, get training. If you don't know something, ask, have real referrals that are meaningful, and you kind of know what you're doing when you make those suggestions. For pediatricians, additionally, screen and assess for medical issues that may have mental health symptoms was a big one, as well as, really making certain that consultation is available for guidance and advising in the pediatric practice. And talking to kids, talking to young people and to children about mental health and substance use. For schools, early intervention, being more trauma informed, not blaming and shaming families, parents, was a key recommendation. And these are the recommendations that sort of had multiple people set sort of the same themes. Youth serving organizations, don't punish children for having mental health systems. Offering peer support across all areas was really promoted by families and by young people. For mental health and substance use organizations, work with families in order to promote recovery. Stop judging kids and families. Treat the whole family. Listen to families. Some of these things that we all know day in, day out are, realities. But this is data that's sort of backing it up. And so with Lifting Voices, we're hoping to put actual data and a methodology you can sort of hang your hat on to the advocacy that organizations like yours are providing. You hear just some quotes, parent voices, if a child is treatment resistant and or refuses to participate in therapy, perhaps because there's an underlying medical issue or root cause that needs to be looked into, run labs before automatically putting kids on psych meds. Stop labeling kids as behavioral problems when they are addicts. If taking a break and regrouping were more ingrained in the culture of the school, it wouldn't feel like the child needing to do so or getting special treatment or doing anything out of the ordinary. Basic stress management skills are needed to be worked into the curriculum and the school culture. And then, really just across the board, we were hearing a lot of quotes along the lines of, please treat children who have mental health issues with the same warmth and kindness that you would have for a medical illness. Behaviors are not the problem, they're the symptom. Really poignant. And just some youth voices. Young people in our earlier samples, we got a lot of qualitative experience that we could pull forward for you today. We didn't want to leave youth voices out, but really, young people are asking for more experience-based therapy. They're wanting program staff to be trained, to train program staff to help kids regulate emotions and use de-escalation strategies. One young person said, I was both chemically and mechanically restrained multiple times for simply being annoying. I just got worse. It was a common occurrence that staff would sit and watch as people were becoming distressed and wait for it to warrant restraint because it was the only thing they knew how to do. One young person, 13-year-olds are not equipped to handle the kinds of hard conversations about safety and mental health that are happening in friend groups. Teach kids about mental health. Make sure they know who to turn to for help. So as you can see, the guidance, the quotes, the recommendations, it's really for all parts of the delivery system. And it's really the voices and the experiences with the data as well as the quotes from young people and from families. Another young person, friends say counselors can't be trusted. They'll tell your parents, they'll call the police. Mandated reporters make it hard to trust anyone. We need to be told what our rights are when we ask for help. It's so subjective and about that person's judgment. So some really great actionable intelligence from young people and from families about how to improve access, but also to improve care. Ellen, back to you.
Great. I'm just going to tell you a little bit more about who the respondents were. So on the next slide, from the July 2025 data cut, what we found is that we received 300 responses in total, and about 250 or 280 of them were parents and caregivers. But we really felt in the end that 82 or 83 of the responses were complete enough across the board that we would really have a robust sample, and that 150 of them were pretty good, but just not as robust and complete. And in that, we are obviously reflecting upon and saying, well, maybe we will send out a shorter survey as well. But what I really want to call to your attention is that we received a pretty representative sample of the insurance market. So 70% of the folks were non-Medicaid and 30% were Medicaid. And we know that in this country, about 1 out of 3 folks are covered under Medicaid. And in terms of race, ethnicity, and language, we know we received perhaps a little bit of a disproportionate, but not badly, but it's 69% of the population is white and about 31% other race ethnicities. We also found something really interesting, which is about 1 in 5 parents describe their child as a gender other than female or male. So about 1 in 5, pardon me, is about 20% of the population is really along the continuum of gender. And so 4 out of 5 was more dichotomous. Are you a girl or a boy, male, female, identifying as such? So this really underscores too the importance of the intersectionality of approach, and also really important when you get to stigma and discrimination and how people are treated. And so we have so much education and training to do and to continue to tailor our approaches sensitive to the person-centered needs. We also have 26 conditions identified in this response. And if you go to the next slide, we can talk about some of those conditions. This is just a bar graph on the next slide, on slide 20, that really gives you a depiction of the range from one person reporting homicidal attempt to down to the bottom 66 reported that their child had anxiety disorder or panic disorder. So out of the 83 responses, and if that parent was, or 82 responses, if that parent was reporting on their child, 66 out of those 82 really were saying that is that was that would be the percent otherwise, or the number of kids with anxiety disorder. And as you can see, this really runs the range. So if you go to the next question, which is, I'm going to take select items here. And this one, I'm going to focus on question 2 and give you a summary appraisal by Medicaid and non-Medicaid. What I really want to share right now is that the Medicaid experience is different than the non-Medicaid experience. And based on our data, parents and caregivers shared that their unmet mental health care needs affected their families differently. So, case in point, if the average for my child has often experienced unmet mental health needs, if the overall average was 70%, the non-Medicaid or commercially insured population actually experienced more unmet needs. If you kind of race down to the bottom, where you say my family's ability to care for my child at home has been impacted by their unmet mental health needs, what you see in the case of the Medicaid column is 60% of parents reported that their ability to care for their child at home was more impacted than the commercially insured population. As these numbers grow, we're going to get better and better data and more what you know as statistical reliability, statistical significance. I'm very interested in the next run of this data so that we can really understand how the payer market works, because we are often right at the whim of coverage. Policy and coverage are critical to our kids getting what they need. So anyway, just food for thought. I'm not going to go through each data point because you are going to be receiving this deck. I simply wanted you to understand what these columns represented. And so if we go to the next slide, and we're really just doing select numbers here, and you'll get a more robust picture. But let's talk about the journey, and let's talk about really the impact. Oh, I'm sorry, Heidi, I believe you're doing this section. Are you? Forgive me. Okay.
Yes, no worries, no worries. Yeah, that was some interesting data about the split between the commercially insured non-Medicaid population and the Medicaid population, particularly around impact on the parents' mental health, the siblings' mental health, just some really big divides there. So definitely when you get these slides, do take a look at some of that data. It's really interesting. So there are more than 150 recommendations for those different parts of the service system. Parents and caregivers offered advice and recommendations for pediatricians, for schools, child and youth serving organizations, mental health and substance use treatment organizations. So you can see here what some of those recommendations and responses, just the percentage shared, how those break down. So looking at pediatricians, Here you can see the differences between the Medicaid population and the non-Medicaid population. I won't read through these, but you can see Medicaid populations, some of those advice was around listening to families and children without judgment, educate yourself a bit about pediatric mental health and the resources available to meet child and family needs, talk to children, don't dismiss concerns, don't dismiss patients. I think we heard that some families were excused from care and referred elsewhere altogether. Consult with a specialist. Non-Medicaid commercially insured families said, test for strep. Again, a lot of folks, PANS Panda was a kind of recurrent issue that was flagged, overlooked medical issues leading to mental health conditions that were then not treated. Speak to parents alone regarding how children are doing with peers and in school to get the full story. Listen to parents, trust them when they have concerns. So similar there, and screen and assess for mental health needs, have on-site mental health services or a real plan for services, not just a list of providers. For our schools, lots of recommendations in terms of, open door resources, trusted access, contact information for crisis resources. Again, peer support, real drumbeat. People want more peer support. Don't second guess external medical or mental health professionals. Trauma-informed policies and practices are needed. Avoid blaming and shaming parents. Intervene early with supports. Engage parents in problem solving. Again, I won't read through all of these, but you can see there's some really rich information here, and it'll even get better once we're really able to do a more participatory approach to analyzing the data. You can see the differences, though, kind of melt away. A lot of the similar recommendations are happening here for these two populations. Youth serving organizations, peer support, more desire for inclusion, provide social skills training, offer programs specifically for children coping with social anxiety, school refusal, seeking to build physical and mental wellness. Pay attention to youth, be their safe place. Treat every kid the way you treat your own child. Another similar quote there. Let kids play sports, even if they aren't good at it. Really just great recommendations for our community-based organization. Know the signs and symptoms, address stigma, teach kids to support each other. You can see how the recommendations are calibrated to the unique settings. And for mental health and substance use service organizations, provide services outside of the office to get to know them. So get out into the community, make new access points, create service access in recreational settings. If you can't effectively treat complex needs, and again, this initiative is really targeting young people and children with complex mental health and substance use needs, refer to someone who can. If you can't do it, don't get in over your skis, refer to someone who can, and be educated, but get support. Don't judge, offer peer support, and listen to parents. And among the non-Medicaid population, stop treating youth who are using drugs like they're adults. Stop applying confidentiality to parents trying to help their child who is an adult or a young person. Offer more groups, less isolating treatments, and continue to learn and train. Get person-centered. More SUD programs for teens. Recognize the risk for marijuana. It's so interesting how similar it is to our first sample. Just very, very similar findings across the board. So I think we're right on time for some questions and answers, and we really welcome the opportunity to talk with you. Any comments as well are very much welcomed.